Is that? Okay. So I would like to thank everyone for coming today to the open day. I'm going to start with a little bit of background about the Digital Health and Entrepreneurship Master's Program. So my name is Adam Dubas. I'm going to be the program lead for this project. So walking through some of the things that we have been developing for this program over the last couple of years. So I think if you're here, you already have an interest in digital health. This is a rapidly growing space. I'm sure that everyone's going to be well aware of the many changes that have happened in healthcare over the last 2 years. The push towards home monitoring, the push towards the remote sensing, the increase in the amount of wearable technology that people are using to track and monitor their own health. All of this fits into what digital health is. It's a rapidly growing space. Healthcare, even in general, is growing. Many countries are spending between 10 and 20% of their gross domestic product on healthcare and healthcare-related products. Again, obviously, the digital health space is a huge sector of this. And so what the goal of this master's program is to capitalize on that and to help provide you with the skills in order to move forward in this space. So the Digital Health Entrepreneurship Master sits within the brand new UCL Global Business School for Health. This is the first business school of its kind anywhere in the world that is specifically dedicated towards health and healthcare. It has many different facets looking at improving the management and leadership capabilities of healthcare, as well as providing those same sorts of qualities to individuals that are looking to go into the digital health and biotech space. So today we're talking specifically about the digital health and looking at ways that we can re-examine how the global healthcare works. The concept of does an elderly patient have to go through the hassle of coming into the clinic every month to have all of their information taken? Is it possible to adapt technology and to teach them the technology in order to do those sorts of screenings, cutting down on the personal ask of the family members needing to take them there, and also just the hassles of moving them? These are the sorts of questions that are being asked that innovations are constantly coming out and focusing in on. And again, that's what digital health is going to look at, is how can we solve those sorts of problems? How can we put the expertise of consultants into the community, whether this is through deep learning or machine learning or big data type tools? So understanding what these are, how these work, is some of the things that we're looking at. But the Global Business School is also looking at trying to unravel the challenges of healthcare. Again, this course being from the digital health space, and it's questioning how can we improve this and how can we move forward. So the program itself it's focusing in on the integration of health and business and trying to do both with equal degrees of competence. So the course is not being focused on teaching you the biology or the medicine in the background. It's really focused in on how can we apply this. So building on what you would have had from your first degrees. This course is ideal for the students that are incredibly quick learners and able to understand what the market forces are driving this. Digital health is a new field. It is rapidly evolving. And so being able to comprehend these rapid transitions and being able to handle that is something that's important. As a student in this course, you're developing the skills and strategies to understand what are the challenges in healthcare, what are the digital technologies that exist, how can you marry these two together, and identifying where are the entry points into the digital health space, what are the solutions that can be done. Learning how to explore potential innovations, once you find your area into the digital health space, what are the innovations that are going on, whether it be in technology, whether it be in wearables, whether it be in computer analysis, whether it be intelligent computer programs, and how can you shape these opportunities, and how can we use these not just to improve the Western world, but how can we use these to improve across the world and able to improve healthcare around the world. There's a great team being assembled to do this. We have a number of practitioners, all of us that are coming to this course. We are living digital health, whether this means that we are consultants in healthcare ourselves, or working in and working with our own companies trying to develop this space. So not only, so we understand the content that is in this space, this rapidly evolving space, because we are doing this every day. So you're getting the opportunity to learn from those, but also one of the key facets of this is working as teams amongst yourselves, as all of you are bringing unique sets of skills to this course, and being able to use these in order to improve the quality of the content for everybody. The program itself, the tuition for students that are eligible for UK tuition is £16,500, and for overseas students that climbs to £29,400. The course that we're discussing today starts this September with a week of introduction that we'll get into in a little bit. So you spend the first week getting to know each other, getting to understand London, getting to understand the course. From there, the course, if you take it full time, is going to last 12 months, wrapping up in early September of 2023, or spread over 2 years if you choose to do this part-time. All of the courses are going to be run out of the UCL East Campus in Stratford, which I'll be talking about in a little bit. It's a brand new campus set up and giving us all the capabilities and access to the resource that we need to make this useful. So how do you work on getting into this program? So you need a UK degree or equivalent overseas qualification of a 2-1. Again, this varies as you go across the degrees around the world. And so the admissions department is able to work with you to understand whether or not your degrees are equivalent and how that works. Individuals who have excessive work experience, who have completed their first degree and have worked in the medical or the digital health space for a period of time, that can be taken into consideration when looking at your application for acceptance. The course is taught in English, and so you need an ELATS level of 6.5 on the test, and none of the areas of the test can fall below 6.0. As part of the application process, you need to provide a personal statement describing why you think this course is good for you and what do you think that you can bring to the course. As again, building into the teamwork, which is very central to the curriculum of this course. And you need one reference that speaks to your capabilities in this space. So if you're sitting here, you came to find more information. And if you're trying to understand, is this program for you? So this program is really aimed at individuals who are envisioning themselves to have a career going forward in the health space, and specifically within innovating and potential entrepreneurship within the health space and within the digital health space. This can be aimed at both individuals that are just recent graduates or intending to graduate this year, and then looking to pick up this course starting in the fall, or anyone who has been working in the healthcare space that is looking to upskill themselves in innovation in the digital side of things, or even individuals that are potentially working in the digital health space and are trying to understand more of the business side of things to potentially pursue the entrepreneurial side of the digital health world. The degree is especially suited for those who, whether you want to necessarily run your own company or be part of the startup scene, providing market analysis and business case analysis skills into a startup of somebody else's idea, or anyone that is looking to just be within the entrepreneurial field, maybe not necessarily starting your own company, maybe working in the space of business analyst for investments, working in the venture capital space, again, trying to support those that are doing the entrepreneurial work. So I talked at the beginning. So the course this year starts the end of September, and we're having 1 week of induction. During this time, this is going to be an on-campus event, or a series of events, sorry. And it's really helping the students to, helping you as the students start to build a cohort, start to understand the backgrounds that everyone's coming from. Again, as group work is essential both in the working world as well as to this course, starting to understand what's going on. During this time, we will also be doing a number of assessments to start understanding better, understand better what your skills are and what you're hoping to do, and to really set the stage for what the course is going to look like. And so the program itself is going to be broken up into several different pieces. This is an in-person course. The teaching will be face-to-face most days of the week, every week of the year. However, there will be a mix of some pre-recorded lectures, pre-module readings associated with each week. And then the in-person events are going to be really focused in on seminars, tutorials, and workshops. So it's really the in-person times are focused on integrating the information that you would have learned with the online pre-recorded lectures, with the online readings, and ensuring that you really understand not only the information, how to apply it, and how you could actually use it going forward. We've developed a very novel curriculum. So you have 180 credits. This is broken into 8 required modules for each semester that are focused in on the technical skills of what is digital health, what is deep learning, what is database curation, what are wearables, how do they work, looking at research methods, how do you understand the information that's coming out, how do you conduct research in the space, how do you do the questions to find your entry points. So first semester is really getting on the technical side of the business, whereas the second term is looking at how do you actually apply this, looking at the human factors, how do you get people to engage with technology, how do you make your marketing employees speak to the people and get them to engage, as well as looking at how do health markets compare across the world. What are the differences between a UK market versus a US market versus an Eastern market? And so then you then go into the summer term, so summer of 2023. And so you have 2 projects during this term. The first project is going to be a research project where you are looking at a specific space within the digital health world, and you are doing research in that and writing a report about your findings, being a series of thought-based experiments. The second project is a group project that is started early on in the first term and carries out throughout the entire year. And in this, you are now actually picking your entry point and developing your business case. And so you're actually working on developing potentially your first business case and understanding the pieces of that. Throughout all the modules, there's a variety of assessments, understanding that each student has their own strengths. So these are a series of written examinations, coursework essays that are done during a specific time period, presentations both individually and as groups, as well as the 2 projects that you do at the end of the year. Some of you may have questions about potential scholarships for this space. There are a number of different scholarships, and this is constantly growing. We have scholarships for women in healthcare leaders. These are scholarships of up to £5,000, sorry, and it's open to any female student who demonstrates leadership potential and is looking to move into either starting their own business or senior management. We also have scholarships aimed at individuals who either live or work in East London. Similarly, these scholarships are for up to £5,000. And again, there has to be a commitment to serving the East London community that is hosting us within UCL East and the Global Business School. There's other scholarships that are available essentially through UCL. These aren't just specifically to the Global Business School. There's a wide range of the scholarships that are available. And again, if you search through the UCL website, you'll see a lot of information on this space. Those coming from abroad, especially the US, there's a number of different government loans that can be available that can potentially help support this if needed. And then there's a list here. And again, this whole presentation will be available for you offline to review. That there's a number of different funding opportunities available to any students coming from abroad. And again, as I said, that the UCL website under scholarships provides a questionnaire that allows you to search for what you could potentially qualify for, and helps start that process off. So one of the big questions is this is a large outlay of money and time. You're taking a year to work at this. So what are the career options for you to do, and what are the support activities that are being done to help ensure that this is a worthwhile effort on your behalf? Starting from the very beginning, during an induction week, there's a real focus on what are these skills, how are they transferable, and what are the markets that you can potentially go in. Especially not everyone wants to necessarily jump into starting their own company straight away. But where can you help hone those skills through work experience? Throughout the year, there's a number of programs and events. We have, as part of that group project, you will have an industry mentor that is helping you at every step of the way, that is meeting with the groups at least on a monthly basis, and that provides not only the help on how to develop that project, but also the one-on-one contact to understand what are the skills that you need, and help you learn what you need to do to be successful in this space once you're done. As the Global Business School of Health, we also have an executive in residence program that is going to bring in executives from a number of health tech companies from across the world. And so they're going to have a period of time every month where you can set up meetings and again, get that one-on-one experience. Again, the teachers that we have brought in, the instructors that we have brought in for this, the guest lecturers that we're bringing in, all of us are practicing in this space. All of us have day-to-day working knowledge of what's going on, and are all here to support you in informal ways, not just in building an ideal curriculum to make sure that you have the skills that you need. In addition to the things the Global Business School is doing, UCL also has a very active career services space that again helps you go through your CV, helps you curate your CV, helps you find things that can potentially help. UCL has a very active innovation and enterprise department that is constantly providing engagement activities where you can go and meet other people. It also has workshops where you can go and upskill and again provide any sort of activities that you think you may need to improve what you're doing, as well as all the alumni networks that UCL as a major global university is able to provide. So in addition to just the space that I keep talking about, unless you may want to just start your own company. If you don't, there's a number of different things this degree would lead you to. We work very closely with health consultancies, whether it be Deloitte, KPMG, the big pharma companies all have digital health spaces. And so finding a role in there, helping them as an analyst, helping evaluate where should they do their next investment, what sort of potential job prospect or company prospects that are brought to them, which one of these ones are going to be most interesting for the company or most valuable to the company to invest in. Management and leadership are very central to what we're doing here. So, taking these degrees, understanding the business side of medicine and of digital health can easily lead to management roles within pharma. Again, all of the major pharma companies have a digital health space. They're desperately looking for the people that understand the business side of things here to join in the management there. As well as any of the startups, we work very closely with Digital Health London, as well as MedCity, two UK entities that are really focused on this space and providing the skills. And so again, providing the linkages to get you the jobs that you are looking for when you are done. So obviously the learning and engagement within the business school is very essential, but obviously the student experience is more than just sitting in the classroom and doing assessments. So what does UCL have to provide you? UCL has the Students Union, which has a number of clubs There's a number of entrepreneurial clubs. There's also clubs dedicated to entrepreneurship within healthcare, within the digital health space. So all of these societies are going to be available for you. Again, additional networking opportunities, both locally and internationally. Even outside of just those sort of professional ones, UCL has over 250 social clubs and different societies on any sort of activity that you may have. 70 sports clubs across a wide range of activities, again, that you can continue to participate in whatever sort of sporting events that you may be interested in to, again, build up more than just the academic side of things. There's a number of volunteering activities and charitable activities, again, within the health space, being linked to a number of world-leading hospital centers where you have opportunities to work there. And again, try to understand more of what are the entry points to the health space. As well as there's always student support if things are going on and you just need someone to talk to if the stresses of academic life are getting to be too much. So many of you may have heard of UCL. So UCL is now moving to its new East Campus. It's a brand new campus. It's built on the edge of the Olympic Park. For those of you who have not been there, the Olympic Park after the 2012 London Games has been turned into a giant park. It's a green space. It's right around, it's along one of the canals. So it's a great place to walk and to come through. There's a brand new accommodation for students being built there. East London has a wide number of activities to participate in. It's rapidly evolving, and so there's a number of great restaurants. It's right next to the Westfield Shopping Center, and which provides activity, any sort of needs that way. And then obviously being on the Olympic Park, there's a number of sports facilities. It's well connected. There's Stratford Station has the DLR, which can easily get you into Canary Wharf or anywhere across East London. The Jubilee line can get you through most of central London via London Bridge, as well as rapid transit to King's Cross to get across North London. I see a number of you have started to post questions. I will answer them as soon as I'm done with the presentation here in a few minutes. But again, if you have questions going along, please put them in the Q&A section. So life in London in general. Maybe if you don't want to be close to the East London space, UCL is based in Bloomsbury near King's Cross and Euston Station, which is again only an 8-minute transit ride from the UCL East Campus. London is a vibrant city with tons of activity, whether it be sports events, restaurants, parks. It's an incredibly green space to be. Most of the museums and the galleries are free, and most importantly, it's ranked as the top city in the UK for students. And it really is a very livable city. There's outdoor spaces to escape, as well as always something to do, even if you're on a limited budget. So just in wrapping up here, if you're interested in other things involved with the Global Business School or other potential degrees, immediately after I'm done here, there's going to be a great presentation on universal healthcare coverage, a question of financing that. So there's still time to sign up for that. So if we end before 1 o'clock, you can hop over there and understand that. If you're potentially interested in some of the other degree programs, they're listed here. And again, you can just look at the Global Business School website, as these are always constantly being updated, both with the webinar series, other activities and events that the business school is putting on, and potentially other short courses that may be of interest. And so with that, I will open this up to questions. So there's 2 questions in there, but again, if anyone has other ones, please go ahead and put them into the Q&A. So the first question is, what is the difference between this program and the Bioscience Entrepreneurship Masters at the Institute of Ophthalmology? So I've been part of the course at the Institute of Ophthalmology since its creation. The biggest thing is that this course is assuming that you have the science background. This one is really focused in on understanding the management of management side of things, the business side of things of the health space. So this program specifically is on just digital health. You may also want to take a look at the Global Business School of Health has a pharma and biotech entrepreneurship program that is looking at that side of things on drug development and on the creation of biologics on the biotech side of things. So whereas the bioscience is much more broad, the bioscience entrepreneurship is much more broadly on non-health applications. It does touch on the health, but it is going into things like, how can we make renewable fuels? How can we create enzymes to look at waste removal? So there's a large biological aspect to the bioscience entrepreneurship course, whereas this one is really focused on purely health and largely onto the business side of things. So regarding a part-time degree, how is the face-to-face time broken up, and can you plan it alongside work? So the way that it works is that you'll be having 4 modules each term. Each module will have an assigned day that will be published, or that is going to be determined in the next couple of weeks. So by the time you are accepted to the course, you will know that you are taking X modules each semester. You will know which day of the week that those modules last. The modules are about 3 hours a day. So it is, so the actual in-class portion is about a half day, depending on what your commute times are to get to London for that. So you will know well in advance when the face-to-face sessions are going to be. Again, they are up to 3 hours per module. And again, so you'll know what day, whether it's a morning or an afternoon session well in advance. So you're able to hopefully plan that around your work. Okay, so the question is can you use the TOEFL exam for English proficiency? UCL prefers for a master's level course the ELETS. However, we can take that up with the graduate office depending on what your scores are on the TOEFL, whether or not that would be accepted. The next question is, okay, so the question is if you require scholarships in order to take part in the course, but they don't come through in the year 1, are you able to postpone the start of study? If you are accepted to the course, UCL policy is that you are able to delay it for up to 1 year. So the students are being taken, so the next question is, are students accepted, or how many students are accepted? So the students are taken in as a cohort. Obviously, if you're taking it part-time, you are contributing to 2 different cohorts across 2 different years. For year 1, or so for this fall, we will be accepting up to 50 students. So the timeline, and then what is the timeline for the program activities in a part-time course? Typically it's going to be that you would take half the modules. So you take 2 modules in the first term, 2 modules in the second term. And then usually the projects are then going to be based. So then your second year of study, you would again do two modules in the fall, 2 in the spring, and then you'd be doing the projects during the summer. So the second, unfortunately, you do need to have the background information, all the coursework in order to do the project successfully. So you are going to have a slightly heavier second year in that you're going to have to do the projects during the 3rd term. Okay, so the next question is have we ever had graduates with a clinical work background, such as doctors and nurses? Are they capable of learning the aspects of business and leadership, given their backgrounds from management and finance? So the answer to that question is so in these entrepreneurship courses, we have had a number of individuals from clinical work. Again, so anyone coming from the clinical space is going to have a very unique set of skills in understanding what are the needs in the digital health area. So that is what you are bringing into this. These courses are largely aimed at people from the biological backgrounds and to teach them the management and the finance side of things. So having people from the clinical space is essential. Yes, you will be able to learn the business aspects of things, because the business and the management is really the focus of this course. And so not that we're assuming that you have no background, but anyone with just a very minimal background would be successful. So there's a second question here about TOEFL. Unfortunately, I don't know the answer to that today, but we can definitely get that answer back to you. So in any of the modules, do you touch on such subjects of artificial intelligence? So there's actually two modules. So there is actually a telemedicine and artificial intelligence module that is offered during the term one, which focuses in on applications of artificial intelligence. You also have a digital opportunities module taught in term one, that this is really focusing in on the methods behind artificial intelligence. How does it actually work? A little bit more of the theory based. You don't need to, there's no programming requirement in any aspect of this course. Even during the course, you don't have to learn how to do this, but there is a basis in what artificial intelligence is, how does it work, and what is the theory behind it that can actually push it to understand where is it going to push medicine in the future. So RE, the part-time option, how does that work? So groups will be made up. So students that are coming through on the part-time option would be put together so that they will have the consistency across the 2 years. So anonymous attendee, are there flexible routes available for the modules? I'm going to take that in two different ways. If I did not answer your question, please provide a little bit of a background, and I'm happy to elaborate. So as far as flexibility goes, for this course, there are 8 required modules, and they are taught in the, there are 4 that are offered in the fall for term 1 and 4 that are offered in term 2. And so there actually is not very much flexibility. The flexibility would come into if you do it as a part-time, depending on, you could then choose which modules you're going to take in year 1 and year 2. If that did not answer your question, anonymous, please rephrase as what sort of flexibility you are looking for. So the English proficiency, so one of the options is that if you're in a degree program that was an undergraduate degree program that was taught in English, and that is shown on your transcripts, that does satisfy the English language requirement. So if you're coming from a country where English is the official language, you do not need to take the English proficiency exam. So there's a question, would this course be able to be taken remotely? So the short answer is no. In the long term, there are requirements to be in person. Obviously, if people are sick, there are options available for a presentation or two to be done remotely. But in general, this course will be done face-to-face. And the way that it is designed is a requirement for you to be there to participate in the courses. Are the projects done remotely? Both the business case project does have an in-person presentation. However, that doesn't mean, so there is a period of time that you would have to be present in the UK, in London, in order to do that presentation in person. Although the research side of things may not necessarily need to be done in person in London, although this is a group work. And if the group is present in London, it would be highly advisable to be present to contribute to the group, because group participation is important. So UCL career support. So UCL and the program in general, we are committed to all of our students, regardless of whether you are a part-time student or you're doing the course full-time. So all the career support, whether it be from UCL centrally or the programming that is present within the Global Business School of Health, this is available to anyone who is registered as a student, whether it is a part-time or full-time, whether you're full-time or part-time registered. So there's a question, is that if the official language, so if you're coming from a country whose official language is English, but your undergraduate degree was in a different language, a passport of birth or legal residency in a country is usually accepted as requirements, but that has to be taken up on a case-by-case basis with the admissions office. Okay, so there's a question. Anonymous attendee is a senior professional in the digital space with management experience, but with no education or professional background in health. Do you think this course is right for me? As you said, that me presenting said that there is an expectation of students to come from a pharma background. So there's a lot of different options for you available here. The course is focused on the leadership and management, which you may already have, with the health underlying. It's going to be a bit of a uphill struggle, I'm sure, to understand all of the health, depending, just because you don't have education in health, formal education in health, doesn't mean that you don't know what's going on. But it may also be interesting to attend some of the other courses that are available. We have the MBA programs, especially if you are already in management space. There's several information sessions coming up related to the health management MBA, as well as the global health MBA. So it may be worth checking those out to see if those are a better fit. So in short, this isn't a bad space for you. However, given that you already have management experience, one of the MBA programs may be better. Oh, sorry. So I made a comment that the module timetables will be available shortly. This is an ongoing process that we're trying to work out. We're hoping to have it done quickly, but there won't be a there isn't an exact timeline for when that's going to be finished. We're trying to match everything up. So where to check this? Unfortunately, it's likely to be in the pack after you've been accepted. We'll have the availability of that information. Okay, are there any other questions left? Okay, well, I'll give people, oh. Okay, so the question is when do we find out if we're being accepted? Acceptances are being done on a rolling basis. By the end of April is the end of admissions. So by then you will have a definitive answer, but acceptances are being done as we go through the applications. So it could be any time over the next couple of months. Okay. Any final questions? So the question is this course aimed only at recent graduates, or can it be for individuals that have several years of healthcare experience and an MBA and are wanting to enter the digital space? So the course is aimed for anyone who wants to enter the digital space. So regardless of how much experience or other education that you have. There are going to be a number of overlaps with the management that you would have learned in the MBA. But if you're interested in having the course on understanding how these technologies work, these are going to be the focuses of this course, and that is going to be useful information that you would gain that would not have been necessarily covered within medical practice or within the MBA. So there is information here. However, if you do have extensive experience in the MBA, there's a number of short courses that the Global Business School is running. I'm running a course in May on healthcare startups. It's a 3-day program that is really a crash course on the digital health space for individuals that do have extensive experience and are looking to enter the digital space. So this course would be good, but there's also other short courses that may be useful in the interim. Any other questions? Okay, so the first question. Okay, so the question is, the person is looking to bring digital health innovation and the ability to invent new technologies to help clinicians work better in the hospital. Is this the right choice? Absolutely. So the point here is to understand, how do you take an idea, or how do you identify the problem within the healthcare setting? What technologies exist, and how can you actually innovate them? Working in most healthcare systems around the world, one of the biggest things is writing the business case. How does this innovation or how does this change bring value? So these are the exact skills that we are focusing this course on. So even if you aren't looking to start your own company to bring the technology, just writing those business cases from within the healthcare service itself is one of the essential skills that you're going to learn from this course. So yes, this course would be absolutely the correct one. So students are looking to go into health consultancy. So previous entrepreneurship courses in the health space that I've worked on do also go into investment banking. So yes, the skills that you're looking here, or the skills that we're looking to teach you here, are to evaluate what is an idea, how do you fund it? And so whether that means that you're applying this in the space of starting your own company, or you're doing this from the side of evaluating other people's ideas from the investment side of things. So both sides of that equation would be answered by this course. So yes, the skills that you're learning here would be viable for health consultancy as well as investment management. Yes, the 2022 cohort is the first one for this course. So you do apply for scholarships in the same time as your application, and you then have the choice at any point to whether you accept and whether you find other scholarships if needed, or you can always defer the program for a year to help find more scholarship funding if needed. So there was a request to put the modules together yeah,